Yeah. Good morning, everybody. So we'll be talking about the ERG, that is visual electrophysiology. So there'll be a keynote address by Dr. Peter. He'll be talking about the ent- entopic images of the retina. So we are there to hear you, sir. Please come over.
Thank you. Good morning. So yes, mine is not about electrophysiology, but about entoptic images. And no, I don't know how to. So these, of course, are visual effects that are. These, of course, are visual effects that originate from the eye itself as light interacts with the ocular structures, making internal processes or features visible. How do I move it along? There's the. So often overlooked, they're important because patients are naturally curious. Some have pathologic implications, and particularly in the past, some could be used as tests of visual function. So the blue field endoscopic phenomena is where one sees fast-moving bright spots near fixation, particularly when looking at a uniform field that is blue, like the sky. Most likely these spots represent the leukocytes within the perifoveal capillaries, and their presence implies a healthy foveal circulation. Another is visual phosphenes, which are streaks of light, flashes or patterns seen either in the dark or as a result of eye rubbing. The ones associated with quick eye movements are a sheaf-like pattern when the eyes are moved quickly from side to side when you're completely dark adapted. And I guess none of you are suffering from jet lag, but if you woke up early this morning, you could try it out, as I did. Pressure phosphenes can also occur. The common one is due to eye rubbing, which is a feature, of course, of some blinding congenital eye conditions as the baby tries to get some visual stimulation. But even blowing your nose can give mechanical pressure. And of course, Moore's lightning streaks. The temporal lightning-like flashes seen predominantly in the dark or when one moves the eyes quickly can be a precursor to PVD, which of course is not always so benign. You'll note many of these are named after people in the 19th century who first described them. So Purkinje's tree is named after another 19th century Czech, and it's an image of your own retinal vasculature. If you close your eye and get a torch and rub underneath it, illuminating your eye, you'll be able to see your own retinal circulation. Maxwell is better known for his work on electromagnetism as a physicist, but he described a blue spot in the center of fixation due to the macular pigment. You can also pick it up if you look at a field of blue spots, and you'll notice that the one you're looking at is bluer than the other ones. I hope you agree. And of course, this is due to the macular pigment. Macular pigment also features in Heidinger's brushes, yellow brushes around fixation in blue or plain polarized light. It can be disturbed by foveal disease. And the Stiles-Crawford effect. So in the 1920s in England, when automobile accidents were increasing, Walter Stiles and Brina Crawford wanted to measure the effect of light intensity on pupil size. And they found that luminance of the pupil is not proportional to the area of the pupil. Luminance on the retina is not proportional to the area of the pupil, but rather it decreases for light entering near the edge of the pupil, probably because light is coming obliquely through those photoreceptors and so therefore getting subject to interference. Also, if you're myopic or hyperopic, the maximal illumination changes and becomes asymmetric on the retina. But there's still more to discover, not just in the 19th century. In 2022, it's shown that the mitochondria and photoreceptors can act as microlenses to deliver light with an angular dependence, and this could be part of the explanation of the effect. So there is still more to find out about entoptic images. Now the one is blue arcs of the retina. Classically, it was said when you are staring in at a fire in a dark room, so what people used to do 100 years ago. Perhaps it's set off by activity in the nerve fibre layers, setting off the cones underneath it. And there are many types of after images and many causes, too many to go through, but all are lingering visual impressions, either a positive or a negative after image, depending on whether they have the same or complementary colours. Some are indicative of pathology. Here's a couple. So if you look at the waterfall for a minute and then look away, you'll still have motion artifact. Or if you look at one of the coloured dots on that girl's face, when you look away, you'll see a negative after image. But you have to look at it for maybe 30 seconds or a minute, preferably, which we probably haven't got time for. And then, of course, in the dark, it's never completely dark, thanks to spontaneous neural activity. Another one, of course, is floaters, which, of course, can have many causes, often seen against a uniform background. And mentioning floaters, it's important to remember that sinister conditions also cause entoptic images or images that people may confuse with entoptic images. So retinal traction and mechanical pressure can cause phosphines, and transmission dysfunctions, for instance in serous detachments, can cause to moving lights. Thus, retinal vein occlusions can give you flickering, as can PIC, as can the paraneoplastic carcinoma and melanoma associated retinopathies from abnormal retinal stimulation. Whereas uveal melanoma, which causes serous detachments, which causes traction on the retina, and which eventually invades the retina, can cause a whole multitude of different images. Starbursts are most commonly due to optical imperfections such as cataract, while tiny flickering points of light can occur with retinal or neurological disease. Well, of course, the latter is not an entoptic phenomenon, rather a photopsia. And abnormal colour perception, just to round that off, is also due to many causes. So persistent positive visual phenomena, in contrast to entoptic images, are usually neurological in origin. Perhaps the most common neurologic cause of persistent flashing lights that could be confused for an entoptic image is migraine, which of course often features a visual aura, the classic aura being the fortification spectrum, although heat haze images and scintillations are also possible, but they're longer lasting generally. And of course, migraine can come from the retina too when it's monocular. And it's been shown to be associated with retinal artery spasm, as per the above image, which was taken during a rare observation during a retinal migraine. Another distinction between entoptic images and other images that are more neurological is those that come from higher up in the visual pathways tend to be more complicated. Think of sort of the basic white flashes versus little green men maybe you might get in psychoses. Psychoses are probably the highest, right? So psychotic hallucinations, i.e. images and thoughts that people believe and act on, are not actually that uncommon and obviously are cortical in origin rather than entoptic. The other group of people that we might commonly see getting visual hallucinations are those with low vision resulting in Charles Bonnet syndrome. These are also cortical in origin, but it's important to remember these people are not schizophrenic and reassure them about it since they're aware that it's not real. Thank you.
Yeah, altogether it was a very neat topic to us. Fantastic topic, and you covered so many things. It used to come to us, but we never thought about it, how it comes, and very nicely done.
One thing that bugs me in particular is when registrars say this person's got flashes and they never go into it further, and they just instantly get hold of the vitreoretinal surgeon thinking it's a VR problem. Many times it's not.
Yeah.
Excuse me,
So that's
I love
one
you.
thing that I think
हम लोग तीनों का लो।